topic of discussion is the drug that's name is Abilify. Abilify, generic name of Abilify is Aripeprazole, and it is available in the different dosage forms like tablet and oral solutions, orally disintegrating tablets and injection. It is Aripeprazole and it belongs to atypical antipsychotics group. Now here are some warnings and precautions associated with Abilify or the Aripeprazole. Abilify or Aripeprazole increased mortality in the elderly patients with dementia-related psychosis. So, increased mortality in this case of the dementia-related psychosis if they are treated with the antipsychotic drugs like Abilify Aripeprazole. That is not approved for such patients, and also safety experience in elderly patients with the psychosis associated with Alzheimer's disease. Then indications and usage for Abilify. Abilify oral tablets, orally disintegrating tablets and oral solution are indicated for the treatment of schizophrenia, acute treatment of manic and mixed episodes associated with bipolar disorder, adjunctive treatment of major depressive disorders and irritability associated with autistic disorder, and also in the treatment of Tourette's disorder. And Abilify injection is indicated for the treatment of agitation that is associated with schizophrenia or the bipolar mania. So here is the dosage form and administration for the schizophrenia. The recommended starting and target dose of the Abilify is 10 or 15 mg per day, administered on once a day schedule without regard to meals. And Abilify has been systemically evaluated and shown to be effective in dosage range of 10 to 30 mg per day when administered as the tablet formulation. Then in bipolar 1 disorder, acute treatment of manic and mixed episodes. In the adults, the recommended dose of Abilify starting dose in adults is 15 mg given once daily as monotherapy and 10 mg to 15 mg given once daily as adjunctive therapy with lithium or the valproate and without the regards of the meals. Then adjunctive treatment of major depressive disorder. The recommended starting dose for Abilify as adjunctive treatment for patients already taking an antidepressant is 2 to 5 mg per day. The recommended dosage range is 2 to 15 mg per day. In case of irritability associated with autistic disorder in pediatric patients, the recommended dosage range for the treatment of pediatric patients with this irritability associated with autistic disorder is 5 to 15 mg per day, and dosage should be initiated at 2 mg per day, and then dose should be increased to 5 mg per day, and then increased to 10 or 15 mg per day if needed. In pediatric patients with the Tourette's disorder, the recommended dosage is 5 to 20 mg per day. For the patient's weight less than 50 kg, dosing should be initiated at 2 mg per day with the target dose of 5 mg per day after 2 days, and then dosage should increase to 10 mg per day in the patient who don't achieve the optimal control. So here are some adverse effects of Abilify or the Aripeprazole. There is increased mortality in elderly patients associated with dementia-related psychosis and increased risk of cerebrovascular adverse events including a stroke. In suicidal thoughts and behaviors in the children, adolescents and young adults, and neuroleptic malignant syndrome can also occur, and tardive dyskinesia as well as. It can also result in metabolic changes, pathological gambling and other compulsive behaviors, and also static hypotension and history of falls, leukopenia, neutropenia and agranulocytosis, and seizures and convulsions can also occur, and potential for the cognitive and motor impairment increase along with the Abilify, and body temperature regulation may disturb, and it can increase risk for suicide.